you know, the I mean, we spoke about the patients and the unwillingness to talk about it. Um, um, there's only pads. You just have to put something in your pad. You have to collect the urine with a pad, and that's what's available. And I think that's the misconception because you want to talk about it. So you look at it, and then you need to find who do I talk to, and that's another thing I can see. And culturally, it's very where do I find the know-how? So you can talk to your normal family doctor about it. They might know something, maybe not. So here there is like a lack of. I think it's connected to from the patient side of view is that we don't talk about it. It's not on the table. We don't know where to go, and we only hear about the pads. They are huge companies. They advertise, and they have the bards and the essays and all these companies. They're available all over. You can get them. So will deal with myself, and instead of trying to find out how can I manage this in a different way. So I think that's from the patient side. I think Julie probably has a better insight in this than me. On the
Well,
other hand, on the healthcare, on the yeah, sorry, on the
no, I was going to
healthcare
say, I
side,
think you're right that urinary incontinence products are not the only way to manage UI, and I think that's a
yeah,
great takeaway from that. Go ahead. I
yeah,
didn't mean to interrupt.
yeah. No, no problem, no problem. So on the healthcare side, it's the same thing. We have a catheter. You come into the ER, and you need to take a urine sample, and you put a urine catheter. Only 50% of the patients with symptoms of UTI, which is very common in elderly, and they can produce midstream sample. You put the catheter in. Well, 50% don't have UTI, but you cause a UTI, a cavity, with putting the catheter in, and you just routinely put it in because it's an easy way. There's a stress and an easy way to take a urine sample. Well, you can now with a natural fit device, you can have an external catheter that actually takes the sample or takes it in another way. So that's available, and but to get it into the hospital, it's a huge challenge. The same with the pad. In the hospital, you just use the pad. Well, when you come home again, or you come to the nursing home, you have a pelvic sacroiliac wound because you routinely just put the pad in, you give the patient diuretics, they have a lot of urine, and they're wet. And so a majority of the wounds are created in the acute care situation. And when they come home or come to the nursing home, they have a pelvic wound and they have to go back in or have very costly treatment for that wound. So there is no strategy, and you need to change your routines. So you just don't give diuretics, and if you do it, you don't have enough care staff to turn the patient or change the diaper because you're not interested in incontinence in acute hospital. That's an issue because you have a different goal. So integrating incontinence in the total care when the patient comes into the ER, when it's admitted, this is we have to get the status. Are they incontinent? What kind of incontinence? Just ask the questions and get it in, and it's part of the total care. So I think it's not a misunderstanding. I think it's a lack of understanding, if you could call it
Great,
like that.
great points. Great
Thank you.
points. Julie, you want to build on that?
Thank you.
Any misconceptions about UI and patient and healthcare populations?
First of all, just to reiterate that we are told it is normal. We're always envisioning elderly adults in diapers and such, but it is not normal. It doesn't need to happen. It's common. You're not alone, but it is not normal. Um, the whole thought about it affecting men and women equally, I will tell you in my practice, the younger population that I tend to treat are women, whether it's athletes or postpartum. And then as they get, and sometimes I'll have a few men who possibly had an injury or something along those lines. But as men age with the medications that are frequently given for anything along the lines, and they're experiencing erectile dysfunction as well as incontinence. And like Dr. Cohn said, just based upon the prostate, as men get to that stage where they have either enlarged prostate or prostate cancer, that's when I start noticing an uptick in having men in the practice as well. But it does not just affect elderly people, and that is something that has been very isolating for the younger population, in that there are a lot of athletes that are wondering, why am I leaking as I am doing this? And there could, there's a whole host of reasons as to why this could be happening. And, it's important to explore those reasons and determine the cause of it, as mentioned previously. And, you know, people think it will never be able to improve or never be able to be treated, but that's also not true. There are so many things that can be done. In my practice, if I have patient buy-in and the patient understanding, and if, let's also call it the big if, that if incontinence is really the only problem and that it is due to a weak pelvic floor muscle, um, we can truly help improve the patient's quality of life and decrease the incontinence within, you know, 3 to 4 weeks. They will start noticing a difference. So that could be super huge, in just in terms of giving the patient buy-in that there are things that can be done. But again, there are many different diseases, diagnoses, problems that can arise. So it's important to know the why and how to treat it. And not everybody can be treated the same way. Some devices may not work with that population or that specific diagnosis. That being said, there are things for everybody to be used. And then, just also, again, the stigma and the fact that we're not addressing it. And I feel like if there's one thing that we can all hammer home, it's address it, talk to the patients, talk to people, talk to your friends, talk to everybody, because there is no reason that you should be suffering alone. There is no reason a patient should be suffering alone. And if we can address this with them early on, then we can truly impact a person's life. And there is no reason that we should wait until it is a gigantic problem and the person is unable to leave the house, because, as we know, it creates a whole host of other problems. With the decreased activity, you're going to have less muscle activity, and then they're going to be more weak, and then suddenly you're going to see all of these other side effects spiraling out of control, simply because a person is too afraid to leave their house because they are incontinent. And we could have worked with them to address it, whether it's given them a device, or whether it's giving them a way to retrain their pelvic floor, or a surgical intervention. There are so many things that can be done that a person does not need to suffer.
Julie, thank you so much. Valuable, valuable insights there as we've looked from physiologic to psychosocial, from providers to private healthcare citizens. Lots of great information shared today in this webinar. We're getting close to wrapping up, so I'm going to take just a couple of minutes for thanking our sponsor, and then give you each a moment or so for a closing remark. So thank you all for attending today's session entitled The Emotional Dimensions of Urinary Incontinence. We've touched on many broad topics that are all building back to that point. We want to thank Tillicare, the sponsor of today's event, the maker of the UriCap Female, the only natural fit external female catheter. Julie, would you like to make some closing remarks today? And then Michael, also for you, and then we'll wrap up.
Yeah, so actually, I'm going to make this very personal and share my story, and why I think this is a huge issue and why we can address it. But I recently had laparoscopic surgery to remove endometriosis, and I went into the hospital and was put under the anesthesia and such, and a catheter was inserted while, during the surgery. So I came out of the surgery, and I should be recovering from the surgery itself because it was painful. They found the spots, they had to excise them. It was not necessarily fun, but the worst part about it was I wound up with UTI because of the catheter. And that is something that could have been completely avoided, and I would have been able to focus on my recovery from the laparoscopic surgery instead of suddenly having to deal with a painful UTI if a device such as the Uricap female would have been available and would have been used in the surgery. So I am so passionate about the fact that I truly believe that this device needs to be in more medical facilities and within hospitals and such, because just imagine, here they are, they're treating me for that, and they could have avoided those costs if they would have spent the money to just get that little device. So an external catheter would have been a much better, less invasive way to go. So um, that is my soapbox that I will get off of. However, I truly believe that it is something that would have changed my life and my recovery and made everything better for me if there would have been something like that in the operating room.
Thank you for sharing your story, Julie. And you're also, your cap's also available via Pelvic Tech, your company, correct?
Yes, it is. Yes, it is.
Wonderful.
And
Thank you.
like the other places, we can work with helping to figure out how to use it best. So there's so many different ways to learn about it, but I'm extremely passionate about it, as you can tell. So
Thank you. It's clear. Thank you. Dr. Michael Cohen, thank you today. Would you have any closing remarks for us?
Sure. Thank you, Christy, first for organizing this webinar together, and Julie for sharing so much. And we are very happy at Telecare to be able to introduce the unique Uricap female into the US market now. As Chris said, it's a natural fit, external, soft and comfortable urine collection device. We spent 5 years developing this device. It does not need suction or glue, so it's very unique. And it's uniquely suited, I would say, to Julia, to be used for your patient at nighttime use. Don't have to fall, don't have to get up. And also to collect urine in a case where you need to take a urine sample, or you want to collect urine during an operation where you're leaking. You might be doing it just to collect the urine sample. And it's just into a bag, and the best thing, nighttime use. The patient doesn't have to wake up, or the caretaker doesn't have to wake up. You can sleep through the night. And what does that to your well-being? We all know that. And we're so happy it's also covered by Medicare Part B. And anyone who's interested, you're welcome to visit our homepage or contact Julie. And she's also on our homepage, www.telecare.com. And you're welcome to learn more of what we have to offer. And thank you for attending. I really appreciate it.